Happy Friday. It is World Physical Therapy Day, September 8th, and we are here live on Mary Free Bed's Facebook page and YouTube page, getting to know one of our great physical therapists here at Mary Free Bed. On World Physical Therapy Day, it's an opportunity to highlight the work of physical therapists around the world, and especially right here across the state of Michigan. So I'd like to introduce Ryan. He is a physical therapist down in Kalamazoo, Michigan. And Ryan, just tell me a little bit about yourself.
Yeah, thanks, Chris. My name is Ryan Langejans, and I've been a physical therapist since 1994. Graduated from Northwestern University Medical School. I've been practicing as a spine specialist, as a vestibular specialist, and seeing a lot of other conditions. And I've been doing that since '94. It's been a wonderful, wonderful profession, and I'm just very happy to be a part of the Mary Free Bed family.
So we've heard of physical therapy, but some people might not fully understand what is it. What is physical therapy?
Very good question. So it varies depending on who you're talking to. How I would define it as using exercise, postures, positions, manual therapy to improve someone's quality of life, or in Mary Free Bed terms, to restore hope and freedom.
Down in Kalamazoo in your outpatient clinic, what are some of the types of people that you work with, and what are some of the diagnoses that you and the team come across?
We see a lot of back pain and neck pain. And so it's typically someone that is going through their normal life. All of a sudden they feel some low back pain and they want some help with it. So they come to our clinic and we do a thorough evaluation. And basically we'll look for healing exercises, I call them. Exercises or positions that immediately make a difference in their pain. And then we send them home with that exercise or position, and then they report back about the results of them performing that exercise. So it's a team approach. It's something we do here in the clinic, but it's also what they do at home. And then based on that collaboration, oftentimes, we are able to help them through their condition.
And it ranges how long you work with patients. Sometimes it can be a few sessions, sometimes it can be longer. How does that time change, and do you change the homework you give them and the exercise throughout your treatment plan with them?
Yeah, we like to look for individual home exercises right from the get-go, because we notice that patients get better faster the more that they're involved in their care. So that's kind of my first emphasis, is let's find some things that you can do at home to help your condition, and then we add to it, modify it, do some things you can't do at home while you're in the clinic. And so we like to keep the program as simple as possible. We're not here to create a burden for patients. We're here to create a program that helps them recover from their condition. And so that's kind of a constant process, whether we see them a few sessions or we see them multiple sessions. And how many sessions we see them is based a lot on how well they're doing. If they come back and they're 75% better, okay, let's talk about decreasing the frequency. Since you're doing so well, should we go down to twice a week? Should we go down to once a week? And thank goodness we work with a lot of wonderful physicians in the area that are willing to be flexible with how often we see the patients.
So we've been showing some pictures of your guys' facility in Kalamazoo, and I see all kinds of exercise equipment there. And so sometimes people might get confused, what is a physical trainer and what is a physical therapist? Can you tell me the difference between the two?
Yeah, it's a good question. It's sometimes it's hard to tell the difference. Athletic trainers are often connected very closely with a sport. At the football game, say it's Friday night football, you might have an athletic trainer that is there in case there's a acute injury. They're there to help splint, help stabilize that patient, to get them to, if they need to the hospital, or to the care they need. Whereas a physical therapist can also have training as an athletic trainer. A physical therapist would be more of a person that you would go to a clinic to get formal rehab. So, you think of sport, athletic trainer, they're there on site, whereas physical therapists would be a different training, but also there for in the clinic setting to help them fully recover. So there's a little bit of difference with training as far as, spine specialty. Athletic trainers are more geared towards hurt your ankle, hurt your knee, right there. We're stabilizing them, whereas a physical therapist would take that person with a knee injury or a spine injury and help them recover their function.
And so
But
you've
it's
got, I apologize, you've got PT behind your name, got the letters there, but you also have certified MDT. Tell me a little bit about your schooling and this also the special certification that you have.
yes, that stands for Certification in Mechanical Diagnosis and Therapy, which is kind of a mouthful, but it's a McKenzie certification. So McKenzie was a therapist that developed this type of training that has worked really well for spine patients and also for extremity patients, patients with knee pain or shoulder pain or elbow pain. And so it's a course of advanced training to help us help those patients. And so I went through, I traveled to different parts of the country for this advanced training. And then I took this comprehensive exam after multiple courses over the course of several years. And then took this test, and thank goodness I passed the test and became a certified MDT trained therapist. So it was quite intense. There was a commitment on my part, and my family was very cooperative. But there was a year there where I wasn't seeing much of my kids at their softball games and basketball games and so forth, but it was well worth it. I became a much better therapist for doing that, and I'm very happy to have that opportunity to get that training.
And so many of our physical therapists on the team, whether they're inpatient at one of our facilities or outpatient, they go above and beyond and get some of these extra certifications. So you must show that you're passionate about the work you do, and you've been doing this for 25 years. Why do you keep coming into work every day and do the work that you do?
I get that question sometimes from patients too, but it's really nice to be able to help someone recover some of the problems they have and get back to the things they want to do. Pain is it's so difficult. It's difficult to get through life. They wonder if they can actually get back to their job. They're not sleeping well. There might be some difficulties with relationships because they're in so much pain. And to see them get to a point where they can feel good again. So happy. They're so happy that they're feeling good. It's really rewarding to see people get their hope back, get their freedom back, get their life back, and so that never gets old. So that's kind of what drives me.
That's awesome. And you probably love the team that you work with as well too. Tell me a little bit about the Kalamazoo location and some of the team that's there, and like where about in Kalamazoo it is, and what kind of services you offer.
Yeah, we are on Stadium Drive, as you can see there. It's on the west side of Kalamazoo. It's an outpatient clinic on Stadium, just to the west of 9th Street. We have a team of physical therapists. We have occupational therapists. We have physiatrists on site, a pediatric physiatrist and an adult physiatrist. We have like I said, occupational therapy. We have orthotics and prosthetics and bionics. So we have a huge team. What I like most about our team is that we are really focused on supporting each other. We have a wonderful site leader that just is very open and easy to talk to. We've got front desk staff that care about us and we care about them. So, it's just a really nice place to come to work. We're helping people that have strokes or people that have Parkinson's. Like I talked about spine patients, people that have amputees. There's people that have gone through a lot in their life, and they're looking for someone that can come alongside them and help them, support them, and encourage them, and help them improve their condition. And so that's what we're all about.
Yeah, and so on World Physical Therapy Day, it's a way to honor and celebrate our physical therapists. But I think what's really unique about Mary Free Bed is the collaboration and how you collaborate with your occupational therapy, the physical rehabilitation doctors. Tell me, what sets Mary Free Bed apart from other organizations?
I was just talking to a patient this morning about Mary Free Bed and about this opportunity to speak. And people in the area know about Mary Free Bed. They know how good of a rehab hospital Mary Free Bed is. They know that we're top 10 in the country. What makes us top 10? Well, we have excellent clinicians that are passionate about helping patients. And so people know about Mary Free Bed here because they've had a friend that went there, they had a family member that went there, they went there themselves to the main campus, or maybe they had experience here in the outpatient center. And so, it's just they've had such good experiences with the care they've received, and they improved so much. And it might have been hard work, but the people that were helping them were really on their side, trying to get them to the place that they need to be. So, the reputation precedes even my experience with Mary Free Bed. And so it's nice to be part of the organization.
Yeah, well, Ryan, I just want to thank you so much for chatting with us today. For someone who might be struggling with a little bit of pain, and maybe they've thought about physical therapy, but they didn't know if they wanted to do it, like, what would you say to that person who is maybe a little skeptical or nervous about, oh, what's the work it's going to be? How hard is it going to be? How long am I going to have to go? What would you say to that person who's maybe a little nervous about getting into physical therapy?
Well, we see that in situation a lot. People that have gone to other physical therapy centers and have had a lack of success, sometimes 2 or 3 centers. In fact, at one point, our caseload had 40% of patients that had failed elsewhere that came here. And then we were able to help them. And so I just encourage them to perhaps this be a little different way of looking at it that could be very helpful. And as far as like back pain or neck pain, let's just see if we can find a position or a movement that makes that pain better. And that's sometimes something new for patients. They may never have thought about it that way. They think of doing this exercise, have a good posture, and then hope for the best. But with McKenzie training and also symptom response training that I haven't talked about, it's basically looking at how they're feeling and see if we can help them get better. That's sometimes it's very empowering to patients to look at it that way.
Well, yeah. Well, Ryan, it's just been so informative. Really appreciate you chatting and taking the time. And to you and all of our other physical therapists across the state, we just want to thank you guys all for being a part of Mary Free Bed. Physical therapy is such a great field, really rewarding, as we've heard from Ryan and other people on our team. If you'd like more information about Mary Free Bed, you can get links here on social media, or you can go to maryfreebed.com. There's a great way to get more information and to see about getting an appointment. So thanks so much, Ryan, and for everybody watching this video. Stay tuned for our social media feeds for more content just like this. Thanks, and stay well.
Thanks.